Hello everyone, I'm Kevin Mizikar, Town Manager of the Town of Shrewsbury, and I just want to take a little bit of an opportunity to update the residents and anyone that's interested about the current situation with COVID-19 in the community. Today is Wednesday, October 21st, whenever I am recording this, and all the data that I'm going to provide you today is valid through October 20th. So we'll try to provide frequent updates with regards to COVID-19, but I did want to take the opportunity to talk to all town residents. The only reason I feel the need to do that is because unfortunately we're heading in the wrong direction. We are seeing a significant increase in the number of cases on a day-by-day basis. With that information coming in through the state's epidemiological tracking system. And I thought that it would be important to dive down into the numbers that we're really seeing on a day-to-day basis, sharing all that data with you, providing you with some tips to hopefully help slow the spread, and some other general thoughts that I have. And we'll also discuss what the town is doing as an entity to try to help the spread as well. So first and foremost, as I stated, unfortunately, we're heading in the wrong direction. We are seeing a significant number of increase in cases on a day-by-day basis. And this trend has really been ongoing since about the middle of September. So September 14th or 15th, we started to regularly see more cases on a day-to-day basis. And since that time, the average number of cases per day is also increasing. So we are definitely concerned about this trajectory. And we're also seeing that not only just the number of cases are increases, but the percent positive of those being tested are increases. So it's not just like testing is increasing and therefore we're seeing more numbers. It's both the total number of positives and the total tests being administered are continuing to rise. So I'll be talking a lot today about the state's color-coded designation system. There are 4 tiers, gray being the lowest, having a low amount of cases per day, the whole way up to red. Unfortunately, the town of Shrewsbury, as of last week, moved into the red designation by the state. This information is provided on a weekly basis, either Wednesday or Thursday each week by the state, and I'll provide you with a little bit of information how you can check that out on your own. In order to be red, it's a population base, so you can compare the town of Shrewsbury to any other city or town within the Commonwealth as a whole, and then any other entity that's providing their positivity rate per 100,000 of population. So in order for Shrewsbury to be red, that means we're having more than 8 cases per 100,000 of population. And that means that we're having more than 44 cases over a 14-day or 2-week period. That's the real trigger, more than 44 cases over a 14-day period. And that's the reporting period that the state uses. They use the current week and the preceding week in order to provide their color designations. So a little bit more information on the color designations in general. And you'll also see Shrewsbury's color-coded history here on the screen as well. So as I stated, there's 4 categories, gray being the lowest. That's having less than 5 cases per day, or 5 cases per 100,000 population. Green being between 1 and 3.99, yellow being 4 to 7.99, and then red, again, unfortunately, where the town of Shrewsbury finds itself right now, greater than 8 cases per 100,000 population over the 2-week period. The chart that's shown on the screen here is the trend that we've seen since September 16th, again, which I noted earlier, which is roughly around the time that we started to see an increase in the number of positive cases on a daily basis. We receive information daily through the state's MAVEN epidemiology system. And Starting in September, we were a little less than 2 cases per 100,000 of population. And then you can see that trend on the screen is rather clear, that we have been consistently ramping up the number of cases per 100,000 population every week since then. It's quite a concerning trend, and I'm going to dive down a little bit deeper into those numbers right now and provide a historical perspective since we were notified of our first case, which occurred on March 19th, 2020. What I'm showing here is the monthly numbers, again, since March 19th. And you can see by far since the first case, the month of April as a single month has been the month with the highest number of cases. 147 cases occurred within the month of April. We did see our peak occur near the third week in April. We were talking about the surge at that time, not sure when it was really going to happen, but looking back historically on it, we now see that that's when that occurred. Roughly 30 to 31% of our cases all came in the month of April. But I'll ask you kind of look further down the screen and see where we are now in October. Again, only reporting cases through yesterday or October 20th. We see that October is already the month with the third most cases, and we're on a path to surpass May and have October be the month with the second most cases since the outbreak started in April. So 15% of the cases in total, which as of October 20th were 479 positive cases within the town of Shrewsbury, all have occurred within the last 20 days. So that's quite concerning. It's nearly the same number of cases that occurred over the 75 days prior to that. So the last 20 days certainly show that we're increasing numbers in a very unfavorable fashion. So trying to plot out and show the trend of our cases over time, we have on the screen a graph that starts on March 19th and continues through October 20th. And you're going to see a very clear, what's appearing to be a U-shaped trend at this point. We started on March 19th, and we saw numbers on a smooth basis really increase again to the second or third week in April. So a very steep climb up. That steep climb up indicates that really over a 30-day period, we had a rapid number of increasing cases, so a short time duration and a very heavy caseload increase. And then you see about the midpoint of April, a very slow trough down to our lowest levels, where we actually had many days from early June and into early September where we weren't seeing any cases reported to us on a daily basis. But again, it may not be as steep right now, but if you look from September 15th to October 20th on the far right side of this graph, you see we have the bad news that we're talking about today. The number of cases are increasing, maybe not as significant as they were in April, but we're definitely headed back in that trend for a second surge, a second spike, whatever it is that you want to call it. One of the things that we are worried about is, of course, how many cases that we will get, how long it will take for us to get to a second peak or the peak of a second surge. And then, as was indicated, it may have only taken us about three and a half weeks to get to our peak in the spring, but it took nearly twice as long as that, say from the middle of September, from the middle of April until almost the middle of June to get beyond that surge. So, if we're looking at that right now, if we have another week or two to our peak, hopefully that's all it is, but time will tell. It's going to take twice as long on average for us to get numbers back in check. And talking to public health experts, that's a trend for a contagious disease like this, that you have a very rapid, steep climb up and a very slow decline, because it takes a long time to get that infectious rate back down and out of the community and get numbers in a much more manageable level. So moving on, I wanted to talk about a little bit closer to the near term. So on the screen now, we have the most recent trend lines that we run and look at and try to provide the data to residents on. So on the screen here, we have the most previous 14 days, the most previous 30 days, and the most previous 60 days. So unfortunately, again, we're moving in the wrong direction. We've had 55 positive cases over the last 14-day period. Over the previous 30 days, 88 cases, but obviously the most recent 14 is much greater than the 30-day window. So we're really, it appears to be on a trend for over 110 cases, over a 30-day period, going back 14 days and looking ahead 14 days. So that's quite concerning. Again, getting back into the April timeframe and seeing similarities between that time period and what we're now facing in October. On the right-hand side of the screen, what we're indicating here is that 11.5% of the total positive cases since that first case was identified in March have come within the last 2 weeks. Quite concerning to think that we're growing at such a rapid pace. And really looking at the last 60 days, a quarter of all cases since the start of the pandemic have occurred within that time period. So we hope this catches everyone's attention, and we want to focus a little bit more on the data for another minute or two, and then I'll talk a little bit about what it is that we're asking residents to do and what the town is doing as an organization. So on the screen here, we're putting up age data, and we do share this with residents normally Friday of every week once we receive it. And we're seeing a significant increase in the lower end of the age bracket recently. So what's on the screen here is our most recent report as of last Friday, which was October 16th. And I'm only showing 463 cases because that was the total cases at that time. But of course, we've grown by over 14 cases since this report was published. And we're seeing a much more consistent trend across all age brackets. In the beginning of the pandemic, we were seeing a significant number of cases in the 30 to 40 plus decade brackets. But unfortunately, over the last few weeks, the younger folks, the 0 to 19 and the 20 to 29, are catching up with folks that are older in the community, which is not a good thing at all. So over that, the last, since from October 16th back into September 2nd, the 0 to 19 age bracket is the fastest changing age bracket over that time period. So 75% of all cases that occurred in individuals 19 years old or less have occurred since September 2nd. So that's the fastest growing demographic from an age standpoint. We know some things about this virus. We know that short-term impacts of the virus seem to be less serious for that younger age bracket, but this data clearly shows that some of the original thinking where young people didn't get it just isn't true. We're seeing that more and more now. And then again, the second most significant increase is in the age bracket between the ages of 20 and 29, and those folks have seen nearly a third increase over since September 2nd. So fortunate, good news. Those over 70 is the population that has things most in check right now. Less than 3% growth over this time period, only 2 cases. We know that's a very vulnerable population. And more than likely, these folks are being super conservative and doing what's really necessary to prevent the disease from impacting them. We certainly encourage them to keep going. Of course, the demographic between 30 to 69 are all still growing, significantly. Just like the trend indicates, we're seeing a resurgence in all age categories, and asking folks at all ages to really think about what it is that they're doing and how they're interacting with everything. So the last point that I really wanted to share about the data is, where are we seeing cases? It was really prevalent in the early days of the pandemic that long-term care and congregate care facilities were really seeing a disproportionate impact of the number of cases. So in some ways, the disease was clustered within institutional facilities, and those facilities were having a disproportionate impact on Shrewsbury and many other communities' numbers. That's not the case any longer. Unfortunately, from a tactical perspective, we are not able to specifically isolate any aspect of the community, like long-term care facilities, as being the driver behind these numbers. It's a general community spread. It's not an institutional spread. We're not seeing it coming from a particular type of business when we do our contact tracing. We're not seeing it from a particular institution. It's not being spread through the schools. Contact tracing is so much more robust now in the fall than it was in the spring. I can confidently tell you that we're not able to pinpoint really, other than a general community spread, on how these individuals are becoming positive. What we do see is that over the last month to 6 weeks, private addresses, population throughout the community, there have been 15 addresses that have had more than one individual at the address or private residence test positive. Those 15 addresses have accounted for more than 40 cases throughout the community. So, not only is it more of a general community spread, we're also seeing a family spread. And that's quite concerning, especially as we move from mid-October to late October, and the holidays come into play, and everyone's desire to reacquaint themselves with family and get together. And of course, that most often happens indoors. And as we transition from outdoor environments to indoor environments, we know that this is a respiratory disease, and we're significantly concerned about the impacts of people getting together inside if we're seeing this trend while people are getting together, most likely in an outdoor setting. So what is the town doing? First and foremost, we're trying to have this conversation with the community. We're trying to increase our communication. Starting later this week, if not on Friday, but by Monday, we will resume daily reporting, weekday reporting, Monday through Friday, of the total positive cases that we receive on that day. So we're trying to get this information in front of community members to see. Over the last 2 days, again, we're seeing a significant increase up to 5 cases per day, and that's quite concerning. We need to make some changes. We're going to have to increase enforcement if indicated that we need to do so. We're going to be taking a more detailed look at how businesses are operating, but we're not trying to penalize businesses. There's rules and parameters that come through state guidance, and we're going to ensure that those are being enforced. Honestly, we have no choice at this point because we have to do everything that we're responsible for to make sure that we're doing what we can to manage the opportunity for the virus to spread. We're really trying to analyze the data as deep as possible. We have access to a significant amount of information about the daily cases, and we're gathering the contact information and doing contact tracing, but we'll look at the data to see how people, to the best that we can, how people are becoming infected, and take any actions that we need to. If there is an indication that one particular aspect of the community, the economy, whatever it is causing a disproportionate number of cases, we'll work with the state to take action and do that. That would include identifying clusters and being very transparent with all the residents of Shrewsbury what it is that we need to do. We're working very closely with the state's COVID-19 enforcement and intervention team to put, quote, boots on the ground for proactive educational purposes. We are attempting to get public health experts out into the community to provide general information, a limited amount of personal protective equipment, and reaffirming the personal hygiene measures that we're asking everyone to take. And we're really asking residents to do their part, and I'll talk a little bit more about that in a second. Thinking about what the town can do, I really want the residents, to think about this or to understand how I think about this. The last thing that we really want to do is move back into a spring like lockdown environment where a lot of businesses are closed, a lot of economic activity suffers, and we're impacting individuals' liberties to do what it is that they want to do. That's a secondary resort for us. We want to have this conversation with the community. We're asking you to do your part. We're asking you to think about your decisions that you make so that we don't have to conduct these broad blanket enforcement and shutdowns. That may be our only choice if the virus continues to spread within the community, but again, it's our secondary option that we want to take because we think that we can get the numbers down through personal measures and having folks think about their activities a little bit different. So what can residents do? First and foremost, it's really simple. It's follow the CDC guidelines that have really been in effect since early summer, late spring about social distancing, wearing masks at all times when you're in public, washing your hands frequently, and really thinking about who you're interacting with. You'll hear from the federal level to the state level and now at the local level, you need to recognize that just because someone is your friend or someone is a family member, that doesn't mean they can't spread the disease to you or you can spread the disease to them. So that's going to become much more challenging as we move into the holidays. That may mean you want to have a literally good old-fashioned Thanksgiving outside if you're going to get together with folks. You may want to have a Thanksgiving dinner earlier. You just really need to think about those activities. It's really hard to make some of those personal sacrifices, but unfortunately right now the common good, I think, has to have the preference over the individual and your actions, and it's going to be even more challenging as we move into the winter months whenever folks are congregating indoors. I ask you to think about what you're doing on a day-to-day basis. So the schools do a really good job of mask enforcement. The schools do a really good job of social distancing. But if you're picking up 4, 3, 6 kids and putting them all in the van to take them to a practice and they're not wearing masks in there, we just eviscerated all the good things that happened throughout the day when they were all masked, protecting themselves and protecting each other's. So we just ask folks to think about their own personal activities, continue to follow the CDC guidelines in keeping yourself safe and your family members safe. I look forward to continuing to update the residents of Shrewsbury about what we're seeing and working with you to eliminate the spread of COVID-19. Thanks for watching.